Hi you guys, it's Dr. BT. I want to talk to you about getting prepared for clinicals. So you're going to come to the modules portion of the course, and then you're going to click on for all hospitals, Orange Park Baptist, Memorial, and St. Vincent's. You're going to click the first document, and this first document is what needs to be in your OB clinical notebook. So this is a summary of everything you need. So essentially this is your checklist of what you need to have in your OB notebook. Okay, so the first thing you're going to need is 3 maternal infant assessment forms with your name printed on top. You're going to need to pre-formulate 4 nursing diagnoses. You'll go to your book and you'll get 1 labor diagnosis with interventions, rationale, short and long-term goals, 1 maternal postpartum care plan with the same, and then 2 neonatal. It's important that you get nursing diagnoses which are universal, because at the end of the day, you are going to use this nursing diagnoses to make your note, your SOAP note. So good ones for labor and delivery are, of course, pain related to uterine contraction, risk for injury, risk for hemorrhage, risk for infection, all of those. I mean, there are so many very generalized ones that we can have with that. Postpartum, again, risk for hemorrhage, pain related to uterine involution, risk for infection. In neonatal nursing, we know that cold stress is the biggest issue that we have. So altered thermoregulation related to immature brain function, risk for infection, and risk for injury. You will need to print your reference materials, your fetal monitoring primer, your lab values with interventions, and the picture denoting the fetal heart and lung ducts and shunts. This is very useful to you, as you will need that when we're explaining it to you during clinicals. Okay, so that's your little checklist. And now I'm just going to go write down the things you're going to do. So learning activities and evaluation. So you need to print your evaluation prior to the last day. You need to turn your evaluation in on the very first day of clinical to your clinical instructor. Sorry, it's taking a second. So your learning activities and evaluation. So you guys, you have to do a nursing diagnosis. You need 1 for each day, again, like we had said. I even gave examples of those in here. At the end of the day, you're going to take that nursing diagnosis and you're going to write in your subjective information, what the patient says, and your objective information, what is observed by you. And of course, this class is a pass-fail. Nursing clinical is a pass-fail class, so please do not fail to be prepared. You're going to print 3 copies of this maternal infant assessment document. You will be filling this out during clinicals. So you guys, it's super important to have it printed in there. If you do not have one, unfortunately, we cannot use the copying machine of the unit. It costs them money, and it's embarrassing to UNF that you are not prepared. So there are 2 large issues that you will have if you do not have your maternal infant assessment document. So you're going to print 3 of those, and you're going to put those in your folder as well. And I know it is a long document, I apologize, but you're going to use every bit of it. The next ones that you're going to print is your fetal monitoring, your fetal monitoring guide and your student evaluation, and then your normal heart and lung, your heart shuts. So you guys, please do not fail to be prepared for clinical. Make sure you have all the items that you need. 3 assessments, maternal infant assessments, 4 nursing diagnoses, and all of your reference materials. Thank you so much, and I'm excited for you to start clinical.